And thousands of Americans have been infected with COVID-19, including myself. Luckily, my case was mild, but others have not been so lucky. Hundreds have been hospitalized in the Rio Grande Valley. And one of the only treatments helping people fight the infection, antibodies from recovered COVID-19 patients like me. It's similar to donating blood. Instead, you keep your red blood cells.
And that machine has automatically separates the liquid portion from the cell portion. And the liquid portion is then collected and infused into the patient.
Plasma infusion has been one of the most beneficial treatment options currently available for those fighting the deadly virus.
To date, we have actually infused over 2,500 units of plasma and to over 2,000 patients who have benefited from this.
Dr. Sohal Rao, President and CEO of DHR Health Institute for Research and Development, has been working on an RGV collaborative between 11 hospitals and 89 physicians since April, helping keep the most vulnerable Valley population alive.
They have diabetes, hypertension, obesity, you name it. So when they come into the hospital, they actually come as very sick patients.
Severely ill COVID-19 patients cannot develop antibodies on their own because their immune system is already suppressed. That's why they need antibodies from a recovered COVID-19 patient like me.
So we're currently in the process of donating plasma, and we have a machine here. It takes about 26 minutes. So I should be able to get out of here in about 30 minutes. So it really just didn't take long. I had to do some questions at the very beginning to just make sure that I was eligible to donate plasma. But besides that, everything's feeling good.
Some people who have received this plasma early during the course of the disease have actually shown a very positive and very quick response to it.
According to Dr. Sow, the FDA is working to approve a more concentrated version of plasma antibodies, which is what the president received during his infection.
So what he got was antibodies, which were purified antibodies from plasma. And we are right now looking at FDA. They are about to give an emergency use authorization for the use of antibodies in patients who have COVID-19.
Dr. Sow says until a vaccine is made available, plasma is the only way we can treat the virus.
So it is affecting our fathers, our mothers, our grandparents. And that is actually even more troubling because the mortality and morbidity in that particular group of patients is extremely high.
Dr. Sow says the FDA emergency approval for purified antibodies is scheduled to happen by the end of this month. Now, if you're interested in donating, visit valleycentral.com.